Part of our overall national response to this new outbreak, I am now directing medical officers of health that all cases, confirmed cases, are to be managed in a quarantine facility. Now, this is different to how positive cases were managed when we were last at levels 4 and indeed 3, and shows how serious we are about limiting any risk of ongoing transmission, even in self-isolation and including to others in the household. This will apply to any cases and also close family members who might be at risk as appropriate.
Apply to any cases and also close family members who might be at risk as appropriate.
A reminder, these facilities have been set up specifically and have excellent processes and resources in place to look after people with COVID-19, including health staff on site at all times, and it will help us avoid any further inadvertent spread into the community as part of our overall response.
Got a number of questions about people what do we do if someone refuses to be tested? Well, they can't now. If someone refuses in our facilities to be tested, they have to keep staying. So they won't be able to leave after 14 days. They have to stay on for another 14 days. So it's a pretty good incentive. You either get your tests done and make sure you're cleared, or we will keep you in a facility longer. So I think most people will look at that and say, I'll take the test.
And you know, this idea of testing, right? The PCR test is not very accurate. Is that the test that they plan on using?
PCR to misuse PCR to estimate all these supposed free viral RNAs that may or may not be there.
I think misuse PCR is not quite. I don't think you can misuse PCR. No, the results, the interpretation of it. See, if you can say, if they could find this virus in you at all, and with PCR, if you do it well, you can find almost anything in anybody.
And with PCR, if you do it well, you can find almost anything in anybody.
It's making you believe in the sort of Buddhist notion that everything is contained in everything else, right? I mean, because if you can amplify one single molecule up to something that you can really measure, which PCR can do, then there's just very few molecules that you don't have at least one single one of them in your body, okay? So that could be thought of as a misuse of it, just to claim that it's meaningful. It is. No, there's very little of what they call HIV, and what's been brought out here by Philpott and Isai already. The measurement for it is not exact at all. It's not as good as our measurement for things like apples. An apple is an apple. You know, you can get something that's kind of like, if you got enough things that look kind of like an apple and you stick them all together, you might think it's an apple. But and HIV is like that. Those tests are all based on things that are invisible, and the results are inferred in a sense. PCR is separate from that. It's just a process that's used to make a whole lot of something out of something. That's what it is. But it's not. It doesn't tell you that you're sick, and it doesn't tell you that the thing you ended up with really was going to hurt you or anything like that.
It's not. It doesn't tell you that you're sick, and it doesn't tell you that the thing you ended up with really was going to hurt you or anything like that.
Yeah, from my understanding, absolutely. And we've had if you will, like a beta test of this just happening recently with 3 British teens. They were in Italy. They were teaching over there, and they tested positive for the coronavirus, and they were put in a quarantine facility. And there you see the headline. And in the article, I'm going to read this quote from there because this is important to give people an idea what they may be in for. It says, quote, all of their symptoms had cleared up within 2 days of the test result, but the 3 men were put in a converted hotel, kept in separate rooms with food brought to their door in plastic tubs. Despite feeling well and being told that they were unlikely to be infectious, they kept testing positive and could not meet the requirement of 2 negative test results. The process left them totally confused, given WHO guidelines saying they should have been discharged within 2 weeks. They said medics had told them that tests were probably detecting dead coronavirus cells that are left in their systems.
Where else have we been seeing this discussion?
Yeah, we're seeing it in Canada. In Canada, they're actually having open debate on the House floor regarding these camps. So we have this clip here of Randy Hillier. He's a politician from Ontario. So let's take a look at this one.
All right.
Next question. The member for Lanark, Frontenac, Kingston.
Thank you, Speaker. Speaker, my question is to the Premier. In my supplemental question yesterday, I asked this government if the people of Ontario should prepare for internment camps. In September, the federal government posted a call for expressions of interest for contractors to supply, provide and manage quarantine isolation camps throughout every province and every territory in Canada. These quarantine isolation camps, however, are not limited to people with COVID, but provide a wide latitude for many people to be detained. Surely this government is aware of the intentions to build these isolation camps from coast to coast. And my question to the Premier is, how many of these camps will be built, and how many people does this government expect to detain?
Question. Government House Leader.
Thank you, Mr. Speaker. It is very true that when people leave the country and when they come back in, that the province is suggesting, and the federal government, in cooperation with the federal government, we are suggesting that people isolate themselves. That has been a practice that has been very successful, not only here in the province of Ontario, but across Canada. And we will, of course, be redoubling our efforts to make sure that the people of the province of Ontario remain safe, Mr. Speaker. So if the member is referring to the fact that that one of the public health policies is that when you return from a jurisdiction outside of the province of Ontario or from another country that you isolate yourself for 2 weeks, I would suggest that has been a good policy that has been working. In fact, this House has been doing the same thing since we came back. We are working in cohorts to make sure that the Legislative Assembly can continue to operate. That's why we have 2 separate cohorts, Mr. Speaker.
Response.
And with the cooperation of the official opposition, that is why all members of the Independents have been excluded from that cohort, because we want them to be able to participate in debate. So we will continue to do everything in our power to make sure that this House continues, but that the people of the province of Ontario and Canada are kept safe.
Supplementary question.
Again, back to the Premier. Here's the RFP, and in the RFP it uses clear language to express that these camps can be used for a broad spectrum of people, not limited to travellers. Indeed, it doesn't even mention international travellers. It's just a broad latitude of people. And I'll send over the copy of the RFP after. So your government must be in negotiations and aware of these plans to potentially detain and isolate citizens and residents of our country and our province. So, Speaker, to the Premier, where will these camps be built? How many people will be detained? And for what reasons? For what reasons can people be kept in these isolation camps? And I'd like to have the Premier assure the people of Ontario.
Member, take a seat.
What happened there? Did he get a response?
Looks like he got his. Yeah, it looks like he had his microphone cut, his audio cut on his microphone.
So this isn't a question that's allowed here, even though he seems to be reading from government documents, a discussion of who are we putting in these internment camps. Very, very disturbing, right? And these are, and how many people are aware this is happening in their governments? How many governments are having these conversations and we don't even know what's going on? Right. And we have a part of that contract we can take a look at from Canada, where it does not say international travelers. So this is from Public Health Canada. And some of the quotes in there, it says, in anticipation of possible continued need for quarantine sites over the next 1 to 2 years, given the COVID-19 pandemic, PHAC is considering having a third-party service provider provide and manage the existing sites and all the related services on its behalf. Goes on to say security services 24/7 at the sites by licensed guards, which will be contracted separately. Now, in this contract, it admits there's 11 sites currently, and they're looking at possibly expanding that to nine more. So this is a contract for a third-party service to manage those. And it, like Hillier said in there, it doesn't say international travelers. It actually leaves it open for a wide range of people depending on the need for during this COVID-19 pandemic. People are saying, well, what about America? We're not that crazy, right?
Yeah, well, it's refreshing to see people stand up like they did there in Canada. And I remember from May, you took concern to what someone said in Ventura County. This was Robert Levin, Ventura County's public health director. And we have a clip of that, so let's take a look at what he said.
We are beginning a program today which will certainly grow into something larger and larger, and that is a community contact tracing program, we've done contact tracing all along. When we find someone who has a COVID infection, those people are immediately isolated. But we also work with them to figure out who their contacts were. As we do more testing, we will find more and more people who have COVID-19. And again, we'll isolate every one of them, and we will find every one of their contacts, and we will make sure that they stay quarantined, and we'll check in with them every day. We're going to do a more complete job, and we're going to do a more meticulous job of making it less and less possible for others in the county to run into someone with COVID-19 infection. It's not just our county. There are going to be thousands of people hired who will be these contact investigators throughout the state. And this is occurring in many, many other states as well, perhaps all of the states in our country. Some of the people we find are going to have trouble being isolated. For instance, if they live in a home where there's only one bathroom and there are 3 or 4 other people living there, and those people don't have COVID infection, we're not going to be able to keep the person in that home. Every person who we're isolating, for instance, needs to have their own bathroom. And so we'll be moving people like this into other kinds of housing that we have available.
There was a discussion about a form of camps on the CDC website. I sent that over to you, Jeffrey, because we've been running around over here. What did you find?
Yeah, it was called Operational Considerations for Implementing the Shielding Approach. That's an interesting word there, to prevent COVID-19 infections in humanitarian settings. Now, this is guidance to, it's called to, quote, highlight potential implementation challenges and to guide thinking. And it says here, the shielding approach aims to reduce the number of severe COVID-19 cases by limiting contact between individuals at higher risk of developing severe disease and the general population, low risk. High risk individuals would be temporarily relocated to safe or green zones. Here we go with the military terms, established at the household, neighborhood, camp sector, or community level, depending on the context and setting. They would have minimal contact with family members and other low risk residents. So let's take a look at the table here, how they break this down. We have household level, neighborhood level, and camp sector level. Basically, this is all built around movement of individuals inside and outside of this thing called the green zone. And you can see at the camp sector level, there's going to be one entry point used for food exchanges, a general meeting area where people can have visitors. Kind of sounds like a prison. So let's continue into this document. Brilliant stuff. The further quotes, the shielding approach proposes that green zones be maintained until one of the following circumstances arises. Sufficient hospitalization capacity is established, effective vaccine or therapeutic options become widely available, or the COVID-19 epidemic affecting the population subsides. It goes on.
Just look at that line. I mean, when you hear Fauci saying till the end of 2022 is where he sees some sort of imaginary end to this, though the vaccine doesn't seem like it's going to bring it. Are we talking about the potential that some people could be in these internment camps being protected for their health and safety for, I mean, God knows how long? I mean, it's I think a lot of people are probably shocked right now to know that this is not only being thought about, it's written and on the website at the CDC.